All right, so in today's video, I'm going to go over the Medicare Supplement Plan N. And I want to show you raw data and statistics so that you can go over the information and make a decision if this is the best plan for you. My name is Brian Monahan. I've been a licensed insurance agent working with people turning 65 and going on Medicare for the first time, or people that are on Medicare and want to learn more about it. I've been doing that for the past 16 years. So let's take a look at some of the numbers that I put together to show you whether or not this is the plan for you. So if we look at the chart here, I put up here a Medicare Advantage plan. A lot of people that are turning 65 or it's during open enrollment and they want to know, should I go to a Medicare Advantage plan? This is what all the commercials are on television and so forth. So I put that up here first. Then I put the Medicare Supplement Plan G. This is the top plan, meaning the most people that are turning 65 or that are purchasing a Medicare supplement plan today for the first time are getting this Plan G. Then I put the Plan N up here. Then I also put the high deductible Plan G because that is becoming very popular also. So let's dive into the Medicare Supplement Plan G. Why would you want to get this plan? Well, there's a few different reasons. Number one, I'm going to chop this from 4 different plans, Advantage Plan G, N, and High Deductible G, right down to 3. I would never get a Medicare Advantage plan when I was turning 65 or going on to Medicare for the first time, no matter what. The reason being is because you go on a Medicare Advantage plan and something happens, you have to go through underwriting then to get on a Medigap plan after your initial enrollment period, and they don't have to let you in. You might be stuck in a Medicare Advantage plan forever. Now, is it guaranteed that you'll be stuck there? No. But I would never go into these plans because if you look here at the max out of pocket, and I'm going to go over this, this is what this stands for. Max out of pocket, maximum out of pocket, MOOP, per year. Some of the Advantage plans, $7,550. So why would you go with a plan that if you pay that $7,550, you could turn around the next year and pay another $7,550. We're talking $15,000 in a 2-year spread. That's a lot of money for medical coverage and so forth. So I would never go on this. I don't want to go into details about Medicare Advantage. That's not the point of this video, but stay clear away. You can always call my office. I could explain it to you in 10 or 15 minutes why you want to stay clear. But the Plan N, the premium of this. Now, what I did was I took these states, California, I took like different parts of the country, and I just did the least expensive G plan, N plan, and high deductible G. I put them down and I took the average. So this is basically all different parts of the country. So let's go back to this other chart. So the average premium for someone who's turning 65, who's a male, females are a little bit cheaper in most places, is $106 per month. That's what you're going to pay for the plan no matter what happens. Now, to go into the hospital is going to cost you nothing. Now, what do I mean by nothing? Well, if you go to the emergency room, it will cost you $50. But if you're admitted into the hospital, that is waived. It will cost you nothing. If you go straight to the hospital, you stay there for 4 days, it's not going to cost you anything. If you have a surgery and so forth. Now, you go to the hospital, it's not going to cost you anything. Now we move over to the doctors section. This is for doctors, outpatient centers, and so forth, physical therapists. You're going to pay the first $226 in 2023. That's the deductible. So you pay your $106 every month. You pay the first $226. But then you pay up to $20 each time you go to the doctors. That's for your Medicare Part B. So what does that mean? Well, let's take a look at the max out of pocket, and I'll explain what I did to get to these numbers. So if you look at these max out of pocket per year, which I think is the most important thing, I put down $1,898. Well, how the heck did I get to that number? And what are these other numbers? Well, first I took $106 that you're going to pay the company, multiplied that by 12. Then I added the deductible, $226. Then I took a $20 copay and I said, well, how much could they go to the doctors. I put 20 times for the year. A lot of people are not going to go 20 times, but I did it because I wanted to put a larger number. So 20 times 20 is 400. So 106 times 12 plus 226 plus 400 equals $1,898. This is the most, if in that scenario, the most that you would pay for your hospital and medical coverage. That's if you went to the doctor 20 times. If you go there 40 times, obviously it's going to be a lot more. It's going to be an extra $400 tacked on to this. But this is the max out of pocket. This is amazing coverage for this amount of money. Now, some people look at it and they say, oh, I'm paying $20 each time. And they think that they keep paying out. Well, you'd have to go to the doctors a lot. So why is this plan so special? Well, when I speak with people, especially if they're turning 65 or even if they're 75 or they've been on Medicare for 10 years, whatever it may be, I always go over the Plan G. That's the most comprehensive plan that's out there. And I explain to them, look, here's the premium, $140, whatever it may be, where you are. 140 minus 106, roughly $35 more a month. Okay, so what's the kicker? Why would anyone go with G as opposed to N? Well, with G, you pay the 140 or whatever the premium is, multiply that by 12. Then you have that same deductible, $226 for the year, but you have no copays. So that's the max that you're going to pay. 140 times 12 plus the 226, and you're going to get this $1,906 down here. Now, keep in mind, I didn't even go over yet skilled nursing care. You get up to 100 days for nothing. But the one thing about these plans that people get thrown off from, and I should get rid of this because I put CAT scans in here. That was for the Medicare Advantage plans. But the one thing that these plans people get thrown off about is the drug plan, the dental, vision, and hearing, and of course, the gym membership. Now, this is the ploy to get you into a Medicare Advantage plan. They throw everything at you with the kitchen sink. But with the Medicare Advantage, if you look here, a hospital stay could be $250 a day up to 7 days. I mean, skilled nursing, you only get 20 days as opposed to 100 with the Medigap plans. Max out of pocket's way higher. So these are the things you have to look out for. But let's get back to the end plan. So when you have this end plan, you have your premium, a deductible, small deductible, up to $20 copay. Hey, I put in there $20. It could be less. Then you have your drug plan that you have to get separately. So this throws some people off. Well, wait a minute. What's good about this? Well, I'll tell you what's good. When it comes to the Medicare Advantage plan, if it's an AARP Medicare Advantage plan, you have to get their drug plan. It's attached to the plan. So you will get an AARP drug plan and an AARP dental and vision plan. And maybe they'll throw in silver sneakers or whatever they throw in a gym membership, possibly. With this Medigap Plan N, it's like a smorgasbord or a buffet. You take your Medigap Plan N, it could be from Aetna. All right, I'll take that one. Now your drug plan, I put down here $35 a month for your premium, but there's drug plans that are $5 a month. So if you're only on one or two generics or something like that, you're going to get a really cheap drug plan. So you're not going to need this zero drug plan. Or maybe this drug plan's better anyway than this zero drug plan. Maybe it covers more. So I just put 35 in there, but you get to choose. If there's 30 approved drug plans in your area, you get to choose one of them. And there's no underwriting. You could choose whichever one you want. For dental, vision, and hearing, I put $40 in there to get a plan. Once again, you can choose. If you have Aetna or if you have Cigna for your Medigap plan, you can choose a Blue Cross drug plan or a Humana dental and vision. You mix and match and put it together. Some people find this annoying, but really what the biggest thing about the Plan N is hospital and doctor coverage and so forth. That's the reason why you want these Medigap plans, because when it comes to the Plan G, if you don't want to pay that higher premium and you want to move down to the Plan N, at least you know these big ticket items are covered. Not like the Medicare Advantage plan where you pay $250 a day for the hospital, $300 a day. Then you pay $35 for a specialist. Then you pay $300 for a CAT scan or an MRI. I have to make a phone call soon. Somebody wants to leave the Medicare Advantage plan. They called me and they're like, I don't know if I'm going to get accepted into the Medigap plan. What do you think you can do? I have to look at different things and see what I can tell them, but they could be stuck in this Medicare Advantage plan. I wish they would have called me 10 years ago when they were turning 65, but they didn't. Some other person that pitched this Advantage plan first told them it was a zero premium. Hey, there's nothing better. Probably might not have gone after the max out of pocket and really researched this or told it to them, and that's what they get. So this is the thing. Do I like the Medicare Supplement Plan N? Yes, I do, especially because the coverage is great. Now, with people that contact me, I always tell them about the Plan G or the Medigap Plan N. And then I tell them about the Medicare high deductible G because the premium is so small. And I tell them, you don't want to get on a Medicare Advantage plan because that is horrible, in my opinion. If you're going to do that, get on a high deductible G plan for $40 instead of $0. And believe me, you will be way better off when you go to the hospital or whatever. You won't get stuck there. Your max out of pocket will stay at this $3,180. I'm going to shorten up this video because I do many videos, and I'll put some on the screen up here. Videos about all three of these plans, the G plan, the high deductible, Medicare Advantage. So please watch one of my other videos. Leave a comment and subscribe to the channel. Thanks so much for watching. If you need me, please give me a call at my office.